It's Respiratory Care Week, and we have Kindred Hospital with us today. So let's welcome Chief Executive Officer Susan Drago and Director of Business Development Alyssa Evangelista Morris. Ladies, thank you so very much for being here today. I really appreciate your time. So tell us a little bit more about Kindred Hospitals and what do these hospitals specialize in, and what type of patients do you serve?
Thank you for asking, David. Thank you for having us. Kindred Hospital is a very unique hospital for patients mainly with respiratory failure, some even on life support, and other patients who have suffered a catastrophic event that requires now a longer stay in a hospital. Still seeing physicians every day, very medically complex patients that have endured a difficult time in their lives.
So let me ask you, what type of situations bring patients into Kindred Hospitals?
So we could have some respiratory issues like a pneumonia with a patient who maybe had COPD and now is on a ventilator or on high oxygen. We also have patients who may have had a big trauma, motor vehicle accidents, maybe patients post-stroke that require an extended hospital stay. And we're able to maintain that hospital level of care, with daily physician interventions. Our nurse to patient ratios are the same as the hospitals while still kickstarting that rehabilitation. We follow the Hopkins Move Early program, so we're trying to get these patients up and back to recovery as quickly as we can.
It sounds like a fantastic facility. So can you explain the type of staff that you have and what their duties may be?
Certainly. Of course, we have all physicians from neurology down to podiatry, all of the specialists. Our clinical staff are registered nurses, nursing assistants, respiratory therapists, physical, occupational, and speech therapists. We have a full lab, full pharmacy, radiology, including CAT scans. So what you would find in any acute care hospital, those patients transition to us for a continued care of what they experienced in the acute care setting.
It really does sound like a fantastic facility. This is very impressive. So what are some of the skills or characteristics that you look for in caregivers who work with medically complex patients like the ones at Kindred?
Well, clearly, obviously, they need to be our licensed professionals who have had the experience of taking care of patients in a critical setting. But more importantly than that, we want caregivers who can show a lot of compassion. Families as well as the patients are possibly at the worst moment in their lives. And so the tenderness of our staff towards our patients is paramount for us.
Yeah, I can tell that's got to be a huge deal, right?
Yes.
The compassionate aspect of care is probably one of the more important aspects of it, right?
That's right.
Absolutely. Our motto is, hope, healing, and recovery. So we make sure that our staff is providing that kind of hope and healing and recovery to our patients and families, whether that's the physical acts of nursing, respiratory therapy, but also being their shoulder to cry on in the worst part of their time.
Wow, that is incredibly beautiful. Okay, so before I let you ladies go, where can we go to learn some more information?
Well, we do have our website. If you Google Kindred Hospital, North Florida, you'll find our photos of our hospital. You'll see some testimonials from some patients, and that would be probably the best way to get some information. You can also even schedule a tour on that website as well, and you'll have the pleasure to tour with our CEO, Ms. Susan Drago.
That's fantastic. Thank you so very much, ladies. I really do appreciate it. The work that you're doing is absolutely fantastic. Thank you so very much.
Thank you.
Thank you.